Sure. I think the mechanism of action is actually unique in terms of anti-HER2 therapies, but even other anti-cancer therapies. So essentially, it's not a bispecific antibody as such, but it's a bispecific construct. One end is against HER2, which of course is well established, but the other one is 4-1BB, and that's potentially less well known. So that's an immune agonist molecule. But the idea is that the construct brings together a HER2 positive cancer cell with an activated T cell, and therefore allows for the activated T cell to recognize and attack the HER2 positive cell. So, 4-1BB antibodies on their own were previously evaluated, and certainly they seem to be active. But part of the problem is that they were too active. So a major side effect was that it caused liver inflammation. So, the development of the naked antibodies kind of fell by the wayside. The rationale behind this construct is that rather than activating the immune cell systemically, the immune system is really activated only around the HER2 positive cell itself. And so the hope is that you'll have immune activity, but lessen some of the systemic toxicities that we're seeing with the pure naked 4-1BB antibodies. All the advances that have been made in the last several years have largely involved, really PD-1 antibodies, nivolumab and pembrolizumab in esophageal cancer, and thankfully, within the GI tract, these drugs have some, modest and demonstrated activity in esophageal gastric cancers, but in colon cancer, the vast majority of certainly all microsatellite stable colon cancers just are, uniformly unresponsive to PD-1 inhibition or even combination strategies. So I think again, it was really a red banner day. I think without hyperbole, it was safe to say that those results in totality represented kind of the single biggest advance in the treatment of esophageal gastric cancer just about forever. And frequently in oncology, we accept small incremental benefits, but I think these are either very significant benefits, or they really will pave the way for the next generation of studies. So hopefully, with this momentum, things will continue to improve, on a more accelerated basis.